cardiomyopathy can be mostly is caused by ischemia. So some risk factors that you might expect to see in a patient who is suffering from cardiomyopathy is they've had multiple MIs. They might have had like an infectious disease of the heart, things like that. They've probably got poor diet and are sedentary in their lifestyle. Lots of the times the cause is unknown. It could just be genetic as well. So there's three main types of cardiomyopathy. The first one is dilated cardiomyopathy. So the heart, so we'll say normal heart kind of looks like this. In dilated cardiomyopathy, the ventricles are dilated. So that they've got a lot of blood coming into them, but they're not able to pump as effectively. You've also got hypertrophic. So that's where the ventricle area is really small, but the muscle is a lot bigger than normal. So the heart kind of gets bigger from the outside, but it goes in rather than out. Then you've got restrictive cardiomyopathy, where it's going to look exactly the same as this. However, it just means that the heart wall it gets stiff and rigid and isn't able to pump as well. So some things that you're going to expect to see on this patient: you're going to see dyspnea on exertion. You're going to see a lot of fatigue. You're going to see a lot of signs and symptoms of left-sided heart failure, mostly with these two, with the dilated and the hypertrophic. Left-sided heart failure. However, with the restrictive, you're going to see symptoms of right-sided heart failure as well. So understand the difference in between those as well, with the difference between right-sided heart failure and left-sided heart failure. Some other things that you might see are S3 and S4 sounds. You're going to see angina at rest, but it's not going to be able to be relieved by nitroglycerin. A lot of times these patients don't even have any symptoms at all, and so the first sign that you'll see is death. Asymptomatic. So with these patients, some diagnostic tests that we're going to expect the doctor to order is also an echo. We're going to see a chest x-ray, and we'll see the hypertrophy right there as well. You might see a TEE, an ECG. Some other things that we might see are an MRI. We're going to want to check lab values as well, because if they've got any increased troponin levels or any CKME, I believe is what it's called, creatinine kinase, then we can see that the patient is also having, like the heart is releasing all of these enzymes that are saying that it's damaged. Some medications that we might expect the doctor to order is digoxin. We might expect some other like beta blockers, calcium channel blockers, any vasodilators or anticoagulation, specifically with the hypertrophy or the dilated, because this blood might be a little more prone to coagulation because it's not being pumped as effectively. So some surgery things that we can do, we can do a heart transplant. That's basically mostly what you can do. They can also insert a pacemaker to kind of help the heart stimulate itself to actually pump. But for the most part, there's not much that we can do surgically. So some nursing interventions that you're going to do, you're going to want to assess for signs and symptoms of heart failure, and making sure that your patient is getting better, not worse. This prognosis is pretty poor, so maybe more of keeping a patient at the same level is a better goal to keep. We want to decrease the cardiac workload, so encouraging rest and minimizing stressful activities. We want to teach the patient not to drink any alcohol, because that decreases the cardiac function. And just teaching them how to, some dietary modifications. These patients aren't really going to be able to exercise as much because their heart can't take it and their body can't take it. So we might just want to teach them to be able to eat better to help in any way that they can.